today we are having our anatomy scan with baby number 2. Hopefully we won't be surprised when there's like an extra baby in there, but I don't think that's likely because we've had a couple of ultrasounds already. I'm just taking Shepherd to school. Say hi, buddy. Say good morning. Good morning, Mama. No, okay. So just taking Shepherd to school, and then I have some work to do this morning and some meetings, and then around lunchtime I'll head to the doctor and we will take you along. You ready for school? Yeah? You ready for school?
Yeah.
Okay, it's gonna be a great day. Okay, so just dropped Shepherd off at school, and heading home to get some work done. This morning we had a little bit of a late start, so I'm like running a little bit behind, haven't done my hair or anything yet, but today is a very exciting day. It felt like when we first got this appointment on the calendar for the anatomy scan, it felt like it was so far off, and now it's here, so that's super exciting. Plus we, assuming everything goes well with the appointment today, we have a trip booked for Mexico tomorrow, or sorry, not tomorrow, we leave on Monday, today's Thursday, so hopefully everything goes well and we'll still be able to do our trip. So I'm heading to the doctor. I'm so excited. I think the more that I think about the appointment and just seeing the baby again, in my head I just get so excited and my heart starts beating faster and like the anticipation builds and stuff. So I'm getting so eager to see him, and so I'm driving that way now. My doctor is in the medical center area in Houston, so I'm headed over there. My husband Jeff is going to meet me for the anatomy scan. I have an appointment prior to that, just like a regular, check-in with the doctor prior to like the ultrasound. So Jeff is just going to come for the ultrasound part, and he's going to meet me. He just texted me asking what I'm doing for lunch, and I'm like, not really. I'm having coffee for lunch. So I'm having coffee for lunch because I don't have time to eat anything before my appointment. But maybe I'll encourage him to like go to Torchy's or something and he can get some tacos. So anyway, I will try my very best. Oh my gosh, this Nickerson. Freaking Volkswagen. We'll try my very best to film this is why I always leave early, is because there's always traffic because the whole city is under construction just all the time. So what was I saying? Oh yeah, so I'll try to take the camera and take a video while I'm in the scan, but if I'm not able to, then I'll just do an update afterward. I'm not really sure what they're gonna let me do, but like maybe I can be sneaky about it. So okay, so talk soon.
What's today's date? Okay. Are you ready?
Yeah, it's recording.
Oh, hello world. I'm Jeff, and this is my wonderful and amazing wife, Kennedy. It is October 21st, and we just did the anatomy scan of...
No, it's gonna go live before he's born, so this video. So
and we just did the anatomy scan of our second born son. Today is a special day because, one, our firstborn just turned 15 months today, but also two, we got to see the first glimpse into our second son. We're very excited and to meet him, and we're very much looking forward to it. So what else do you want to say?
They wouldn't let us record during the scan, so we are just gonna put some pictures up with this video, and
yeah, Mom's doing a great job. She's
Just
doing an amazing job.
my brain just stopped working for a minute. Yeah, so couldn't record, and I'll catch you all up afterward on all the developments and the surprise EKG we had to do once I'm out of the doctor's office and in the car.
Ooh.
Oh, okay. Want to say anything else?
Nope.
All done?
See you next video.
Okay, so back in the car, I was not allowed to film during the appointment, and obviously I was not really wanting to film like during the doctor part, but I couldn't film the ultrasound. So basically I show up, so first things first is the doctor appointment, and I go in. I go into the doctor, and I'm thinking, okay, it's just gonna be a normal appointment. They're gonna check like baby's heart rate, and they're going to so I'm thinking it's just gonna be a normal appointment. They're gonna check baby's heart rate. They're going to ask me how I've been feeling, if I've had any falls, like, you know, all the usual stuff. So they go through all that, but then they're like, okay, we're gonna do an EKG now. And I'm just like, what? Like, what is this for? Like, nobody told me they're gonna be doing an EKG. Whatever. So, they bring in this machine. There's two women. One of them is obviously like training, I guess, to be like an EKG technician or whatever they're called, and the other one's kind of helping her and showing her what to do. And so they put all these little stickers like all over my body and do an EKG. Apparently it looks great, and I'm just like, first of all, is this safe for the baby? Like, I'm assuming yes, but like I need to ask. And then so yes, obviously safe for the baby. And then this is standard apparently when you switch to, so after I failed the glucose test, which I'll talk about in another video, like that whole experience, but after I failed that, they basically just transferred, they're assuming I have like some sort of like insulin resistance, whether it's like full-on gestational diabetes or whatever, but basically like, or like, I don't know, like something is going on with my hormones, and but I had a really big baby the first time around. So anyway, when I failed the glucose tolerance test, they hospital policy said that they had to switch me over to a high-risk doctor. So it's still in the same hospital, but it's like a totally different doctor's office. So instead of being with my typical doctor and the doctor that I had last go round, I'm now in a high-risk doctor. So at this doctor, because it's only high-risk cases, I guess like an EKG is standard for them. So that's why they did the EKG. And then since I'm having more visits than normal, half of my visits will be with a nurse practitioner, and then half will be with my new doctor, my high-risk doctor. So the nurse practitioner then came in. She walked me through like a lot of stuff. We talked about everything. We talked about like all my blood sugar testing, and I showed her, we talked about all my blood sugar testing, and I showed her you know, my logs and stuff, and everything looks great. And then they were possibly going to do a pelvic exam as well as a breast exam, but she decided that like I didn't need a pelvic exam at the time, so that's fine. We didn't end up doing that. We were already running behind schedule, I think, to get me out of that appointment and over to the ultrasound. So just move to the park here so I can focus. So she does the breast exam. That's it. And obviously like everything looked fine, no like swollen nodes, no reason to suspect like no reason to suspect like breast cancer or anything unusual. Like everything looks good, basically positive from a doctor's perspective. She was saying that I likely should meet with like an endocrinologist after pregnancy, like, you know, 6 weeks after pregnancy or however long, like beyond that, so that they can just do some more tests and they can see like what's really going on with my body, because obviously like something is going on and they just like can't quite figure out exactly what, and like everyone has a different theory, but at this point, like being pregnant and having so many pregnancy hormones, it's very difficult to see like what's just because of all the pregnancy hormones and then what's like if I have any sort of other like hormonal conditions or whatever like outside of pregnancy. It's just kind of, so she would recommend I meet with an endocrinologist, so at some point after the birth I will probably end up doing that. But so then that was done. I finished up with that probably like 15 minutes later than planned, because then I was late to my scan and they were all like disgruntled about it, but I was on time, like, so it wasn't really my fault. But anyway, I think the EKG just like took longer and they were already running behind. So anyway, so we go into the scan and the baby, so his head, he's looking great. His head is on my right side. His body is like lying across, and then his legs and feet are on my left side, and his body's kind of like facing backwards, so sideways but like facing my back. And because of that, they weren't really able to see his face, and they also weren't able to see really well where the cord was going, where the umbilical cord was going into the placenta. And so basically the technician took all the typical scans. He's got 5 fingers on each hand, 5 toes on each foot. Everything looks great. All the organs are exactly where they're supposed to be. The heart looks really good. The heart rate today was 159, 160. So that looks good. She told us his measurements. He's 76th percentile. So that's obviously bigger than Shep was at this time, which is a little concerning, but I think a lot could change between now and delivery, because obviously we're shooting to have a smaller baby than 11 pounds 9 ounces, not a larger baby. Shep was right on 50% at his anatomy scan. So the fact that this baby's already on the big side, like, could be cause for concern that he would be bigger at birth, but may not be. I mean, they're so small, like I feel like the measurements are really hard to like actually estimate accurately, but I'm not a doctor, so anyway, so but everything's looking great. He looks so healthy, and definitely is a boy. They confirmed, so that's good. Then she went out, she got the doctor. She said the doctor would probably want to come do like some more scanning with the ultrasound wand, because she wasn't able to see, like, because the baby's position was kind of like hunched over and pointed with his back to her. She wasn't able to see everything she wanted to see. So the doctor did come in. They tried to do more like stomach ultrasound stuff. They're pressing really hard with the wand, and it like hurt, first of all, so it was very painful, but I, you know, grinned and bared it. And I'm gonna go to Potbelly and get a sandwich, kind of like as a late lunch, because I'm pretty hungry at this point. It's like almost 4 o'clock, and I haven't had like a proper lunch. All I had was apple, peanut butter, and a big coffee. So I'm gonna get some food, but I'll finish up this video first. So I'll finish up this part of the video first. So anyway, basically they can't see what they want to see. They're trying to see around the baby. He can tell that I have what looks like basically 2 placentas. Like the doctor came in and was doing the scan himself, and so my placenta is on the back like normal. No, no, it's on the front. So I have an anterior placenta, which is like on the front, which I think they said is good, but it's not on my C-section scar, which is great. I guess the placentas can move around, so we need to keep monitoring it and see if it moves onto my C-section scar, but right now it looks pretty good. So that's one piece of worry that we don't have to worry about, which is awesome. So we're not going to cancel our Mexico trip. The other thing though that they said is I have like an extra lobe of the placenta. So basically there's like the main placenta on the front, which the umbilical cord goes into, and then there's on the back an extra lobe, a placenta, which is like not connected to my baby or to my placenta that the baby's connected to. So, which, like, maybe there was a twin in the beginning, I don't know. I had this intuitive feeling that it was twins whenever I found out I was pregnant, and like I didn't ask this question, but like maybe there was a twin and it just got absorbed into the uterine wall or whatever, and that's why there's an extra little baby placenta back there. But I don't know, like that, I'm just kind of spitballing. I'm gonna do some Googling later. Yeah, so at this point I'm in the 19th week, so obviously probably not going to go into labor anytime soon, and there's plenty of time for like these pieces inside to move. So what we're hoping is everything like moves away from the cervix. That's the safest option. If it does at some point move toward the cervix, the doctor said there's like some sort of laser treatment that they can do to try to like lessen that. I'm not really sure what the details are because we didn't get to that point yet. They were giving me a lot of information and like we were already running super long. So we will just take it 1 week at a time. They're going to be doing scans every month now because they want to check on this and just make sure everything's fine. And just with my doctor, that's just what they do. So I'll be going every month for an ultrasound, and they'll check this obviously every time I have an ultrasound. The next one that I'll go to is they're going to do a follow-up to the anatomy scan so that they can see baby's face and profile and kind of some of the things that they didn't get to see today because of his position. And then I'm also going to still do the fetal echocardiogram in a few weeks. I think 3 weeks from now they'll do that when I'm 22 weeks, and they'll examine his heart really closely and make sure there's not like a heart arrhythmia or anything like that. I'm less worried at this point because the heart rate has gone down quite a bit. From like the 185 that it was at, which was causing the concern. But anyway, we will see. And after that, what else? Oh yeah, we did one more blood test. They want to check and see like if the I can't remember, something about the neural tube or something. Sorry, my mom's texting me. I just got on my watch. But yeah, so I just did one lab, which was, you know, pretty normal labs all the time. Like, I feel like there's, how's there any more blood in my body for all these labs? But yeah, and so now I am headed home. Okay, so it's a few weeks later now. Previously we went to our anatomy scan in the 19th week, and things were looking interesting, to say the least. So the baby was doing great, but my placenta, as it turned out, there was an extra placental lobe. And at that time, the doctors could see some blood vessels going pretty close to my cervix. They weren't sure if they were the baby's blood vessels, but they suspected that they were at the time. I think that that's what I recall. And so anyway, they scheduled a follow-up for last week to do another ultrasound, kind of a more in-depth look at the extra placental lobe, a more detailed look at the blood vessels, and potentially a consultation with a fetal surgeon in case there was some need for a laser surgery intervention. So I went in for the ultrasound. They did one kind of external ultrasound and internal, and determined that the blood vessels that were running kind of close to the cervix were actually the baby's blood vessels. So they were coming through from the baby through the umbilical cord to the main placenta that the baby is connected to, and then going close to my cervix, probably within 2 centimeters, the doctor said, and then, but they couldn't get, I guess, a good angle to really see exactly how close, and then running and connecting to the other placental lobe, and that those were in fact the baby's blood vessels, and so that is what I know now called a vasa previa, and it's a very rare pregnancy complication. I think it happens in somewhere between, I guess, 1 in 2,500 to 5,000 pregnancies. Not totally unheard of, like it happens, but it's definitely not as common as something like placenta previa or you know, some of the other placenta related complications that you can have with your pregnancy. So I think my vasa previa is a type 2, which means that there's 2 placentas, basically, or like an extra lobe of the placenta, and that there's fetal blood vessels running from one to the other. A vasa previa type 1, which I think is potentially even more scary and dangerous, is where the umbilical cord doesn't attach into the placenta at all. It attaches onto the uterine wall like somewhere else, or potentially, I'm not sure if it's type 1 or type 2, but there's also, I've seen another video on YouTube of a woman who had a vasa previa where the cord was kind of like marginally inserted into the placenta. So anyway, I guess what we've determined is that I'm now even higher risk of a pregnancy than I thought I was initially. So yeah, we are just gonna deal with it. So I guess being in Houston and having one of the best medical centers in the world, some of the best doctors in the world, I'm at one of the best hospitals to deliver babies in Houston, so basically like one of the best hospitals in North America to deliver babies at. We have some of the best doctors, obviously, who are, I guess, like pretty skilled in high-risk pregnancies. I'm already in the MFM, which is maternal fetal medicine, and so they deal with, like, I guess, the higher risk cases, and so basically what the doctor told me is that there's 2 options. Option 1, they could potentially do a laser procedure. Option 1, they could potentially do a laser procedure to coagulate the blood vessels. So basically, like they would do the laser procedure and kind of laser those blood vessels to stop the flow of blood between all of the vessels. And so at this point in time, there's 2 veins and 2 arteries that are the blood vessels kind of that are a little bit problematic. And so potentially on those 2 veins and 2 arteries, they could do this laser treatment to coagulate those blood vessels. This was typically used in twin to twin transfusion syndrome. And so basically, if that happens, there's 2 twins, they're sharing blood vessels in some way, and one twin is not getting enough blood and potentially could have like organ failure and things like that, whereas the other twin is getting too much blood and could have like go into cardiac arrest and other complications. So what they'll do in a situation with twin to twin transfusion syndrome is they'll do this laser procedure. I think it's called like fetal laser, I don't know. I can't remember what it's called. FLP, I think is what it's called, or maybe SFP, something like that. I was doing a lot of Dr. Google research. But so basically they could apply that same principle to my case, which has been done a few times, I think, ever. So the laser procedure also comes with some risks, and I think the chief risk is preterm labor. So if the laser procedure somehow ruptures the membranes, that is obviously a risk associated with it. I think from my reading, I bought some medical papers online to read up on this, but from my reading, what I gathered is that even if you didn't immediately go into labor upon, the time of the procedure, that the average was about a month or 4 weeks or something after the time of the procedure that most women did go into labor. And because the procedure is typically done, at least after 2010, is typically done around 31 or 32 weeks, that you still end up delivering a little bit prematurely. And so premature delivery, we are going to be asking the doctor what are all of the other risks. For instance, what other risks are associated with this laser procedure? If I am a candidate for it, and that'll help to inform our decision about it. The doctor did say that I had to have, like, the placenta and the blood vessels had to be, I guess, like small enough to do the procedure. So I don't know why or what that means. I can't recall. I think he explained it to me, but it was just a lot of information that day. And so if for any reason I am not a candidate for the procedure, then option 2, or if I choose not to do the procedure, option 2 is the doctors would want to hospitalize me sometime between 30 and 34 weeks, like starting sometime between 30 and 34 weeks. And I would be basically on hospital bed rest up until 35 weeks, when we would do a planned early C-section. And the reason for that is that if I were to start going into labor early, or even, I guess, on time, that if my cervix starts to dilate, then the blood vessels, because they're so close to the cervix, could potentially break. And because those are the baby's blood vessels, the baby would then start losing blood. So that's obviously very dangerous. Babies have a lot less blood than adults do, and the baby could potentially bleed out and die, potentially. And so we want to avoid that. So that's the reason for the hospitalization. If I have any kind of any spotting at all, major cramping, anything like that, they want me immediately to go to the hospital. I'm not supposed to be lifting anything. They have put me on pelvic rest. So for those who know what that means, but no lifting weights, no real exercise. I can still go on walks, which is great because we love going on walks around our neighborhood, but really I'm just supposed to be kind of like taking it easy, not putting too much strain on my body, not doing anything that could potentially like cause me to go into labor, even though right now I'm only 22 weeks. So I'm not really worried about going into labor imminently, but definitely we are starting to prepare for the possibility of having either the laser procedure happen or a kind of a little bit of an extended hospital stay early next year. So 30 weeks for me is going to be January 3rd. So at some point in the month of January, I will probably end up going into the hospital, whether that's going to be just for a few days for the laser procedure, or potentially for several weeks, maybe as many as 5 weeks, for an extended hospital stay for hospital bed rest, and then a C-section. I don't know yet. We're going to be doing another ultrasound between 26 and 28 weeks to get a sense of if the placenta and the blood vessels have moved. Okay, the other thing that the doctor said was that the other thing that the doctor said was that probably in about 40% of cases, he sees this resolve itself. The research I did online said that the vasa previa resolves itself in around 20% of cases. Resolves itself meaning that the placenta and the blood vessels kind of move away from the cervix, and so they're not really at risk anymore. That being said, specifically to my case, my doctors don't believe that it's going to resolve itself to the point where I wouldn't have to have some kind of either intervention or early delivery. And so that being said, we are kind of operating under the assumption that we will be doing one of those things. And so in order to help us make that decision, we are going to be going back for another ultrasound between 26 and 28 weeks, which for me is, I think, sometime between December 6th and like the week of Christmas. And that ultrasound should either, confirm whether or not those interventions are necessary, or if not, if a miracle happens and they're not necessary anymore, then that would show that as well. And as in addition, it would also show if I am a candidate for the laser procedure. And so that would be basically the doctor saying, yes, I think that we could go through with the procedure and that it would be successful. Either, the placental lobe is a little small or small enough. The blood vessels are small enough, whatever. So we will find out more later next month, and we will go ahead and make a decision from there. So I guess what I'm leaning towards at this point is even not knowing all of the risks associated with the laser procedure, just the fact that there's going to be like a laser kind of needle going into my uterus where the baby is and potentially harming the baby or causing preterm labor, having to be hospitalized for that surgery anyway. Those things just make me feel really uneasy about the position that I'm putting my unborn son into. And I am kind of leaning towards wanting to just take the more conservative route, which is hospitalization and then an early delivery at 35 or maybe 36 weeks via C-section. However, I obviously already have a toddler here at home. He's 15 months old right now, almost 16 months old. At the time that all this occurs, he'll be about 18 months old, and thinking about being hospitalized away from him for potentially six weeks or so really obviously is not an ideal situation. It makes me really overwhelmed and really sad. So that's definitely something to consider. At this point in time, the hospital's visitation policy is that no children are allowed to visit. And I think my hospital currently, I could select 4 different adults who could come one at a time to be my visitors. So like my husband, probably my mom, maybe like my mother-in-law, or I don't know who would, maybe my dad obviously as well, could be on my visitation list. But then we would have to, obviously, it would be kind of a question whether or not that visitation policy changed and I would be able to see Shepherd throughout the hospitalization stay. So obviously that's one, I don't want to go without seeing my child because I love him. 2, I don't want to leave my husband here to have to be, essentially like doing all the parenting on his own for over a month potentially. Would also not be great because he's just as busy, if not more busy than I am with work. And so I think I pick up a lot of the slack sometimes on the parenting stuff and kind of managing the home things like chores, errands, that kind of stuff when he has to work a little bit longer. And I think having to shoulder all of that, although he's so willing to do that, of course, for my safety and the baby's safety, I don't want to put him in that position in an ideal situation. So all that to say, difficult decision whether or not to do the laser procedure, but we will just take it 1 week at a time between now and the next ultrasound, and we'll make the decision from there. I really don't want to be hospitalized over Christmas and New Year's, so unless I have bleeding or contractions or kind of some other reason that they would, or I guess they're going to do a cervical measurement next week, and if my cervix is like significantly shorter, when they do like the later ultrasound between 26 and 28 weeks, then that might make them want me to go into the hospital earlier. But ideally, I would be at least through the end of the year not hospitalized. So that is the update over the past few weeks. We just feel really lucky that we live in Houston, where we have amazing doctors. We feel really lucky that there is potentially 2 options for treatment of this condition, and we're still holding out a little bit of hope that I am still holding out a little bit of hope that it'll resolve itself. But if it doesn't, like my doctors think that it won't, then we will just make it work and just roll with the punches. So anyway, if you like this video, this kind of all over the place anatomy scan, vlog, surprise high-risk pregnancy video, and you want to follow along on this journey, or if you want to see the videos which I will do and have promised for motherhood, family life, beauty, fashion, whatever else. Obviously not the most fashionable outfit today, but I'm in my comfies because I'm working from home. Definitely subscribe, hit the like button, and I will see you in the next one.